India, of course, has one of the largest cancer burden in the world, just because of our huge population. So we have a large number of people, suffering from the common cancers like lung cancer, oral cancer, breast cancer, cervical cancer. So we need to consider both prevention as well as early detection. There are different ways cancer can be prevented. Let us think of what we call a health promotion pyramid. At the base, there are certain interventions like improving education, improving the living condition of people, improving economic condition of people. All of these are risk factors. Say, for example, not having education itself is a risk factor for cancer. We know cervical cancer, gastric cancer, and late diagnosis of cancer. These are all related to not having education. And there is enough evidence to say that if we can improve the education of the population, that itself can reduce the risk of certain cancers. Similarly, making sure that there is availability of potable water can reduce the risk of some cancer like stomach cancer, which is essentially related to a bacteria that is generally propagated through unclean water, unhygienic condition. So making sure that people have good living condition, having access to potable water, their socio-economic condition is improved, their education is improved. These themselves will have a huge impact in preventing many of the cancers. So that is at the base. So, but then this requires a different kind of intervention at a policy level, from the level of the government, to make sure that the living condition of people improves. That is one level. Second level of cancer prevention is by making sure that the default choice for people is better. Just to give you an example, if we can make sure that the workplaces, they are smokeless, the smokeless workforce environment is enforced, then obviously we are not giving the people to an opportunity to smoke. So by default, they are getting into a good habit. Similar, another example is reducing the pollution. So so this again requires good public health measures, a good policy from the level of the government, and implementation of these policies. As you know, say for example in India, we have the pollution control laws, but then their implementation is poor. But then if we can make sure that people are not exposed to the environmental pollutions, that will reduce many of the cancers. There is a third level of cancer prevention, which is some specific interventions which we call public health interventions to a large number of population. Just to give you an example, some of the cancers are related to infections. One very common example is the relationship between hepatitis B infection and liver cancer. And as you know, hepatitis B is a purely preventable infection. So we need to make sure that children at birth, they get the hepatitis B vaccine, and subsequently that is followed up with other booster doses. That itself will reduce the liver cancer substantially. There have been many countries, say for example Taiwan, at some point of time they used to have the highest liver cancer incidence in the world. Now because of this very systematic immunization program, trying to prevent hepatitis B, and implementation of that program has reduced the liver cancer rate by 80% in the population. So this is a classic example how you can do some measures at the public health level and reduce the cancer risk. Another similar example is the reduction of cervical cancer. Cervical cancer is the second most common cancer among Indian women. We will discuss about that later on in more details. But again, this cancer is caused by a viral infection, and there is a good vaccine against that. So, if we can vaccinate our young girls, and that will prevent that girl from getting that virus infection, and she will be prevented from getting that cancer, getting cervical cancer in future. So, this is prevention at the level again when it involves public health measures. Another very important public health measure is screening for cervical cancer. So, systematically screening men and women for the common cancers can reduce incidence of some of the cancers, like we can reduce the incidence of cervical cancer, incidence of colorectal cancer, but certainly can prevent deaths from these common cancers like the breast cancer. Breast cancer we cannot prevent by screening, but then we can reduce the risk of death from breast cancer by early detection. So, these are public health measures that need to be taken at the population level. Large number of people have to be brought under the coverage of these kind of interventions. Next level of intervention in the pyramid is focusing on the high risk population only. The classic example is trying to make sure that the smokers, they stop smoking. So, this we call smoking cessation intervention. There are now pharmacological means, that means we can give some nicotine replacement to the smokers, or we can there are non-pharmacological means also, we can do good counseling to them. There are other non-pharmacological methods to prevent to make sure that somebody gives up smoking. If we can make sure that a smoker gives up smoking by the age of 40 years, his or her risk of developing lung cancer by the age of 60 years is as low as a non-smoker who has never smoked in his or her life. But then that requires very targeted intervention, and sometimes that may be costly when you are trying to get the high risk population and do something on them. The last intervention in the pyramid is something what we call behavioral change, to make sure that they, say for example, they avoid the high risk behaviors, say for example improving the lifestyle factors, say for example going for more physical activities, trying to reduce obesity, trying to improve the food habit to reduce obesity. This is something which is targeted to individuals, which requires behavior change communication, but then it is one of the most difficult things to achieve. And if you again think of the pyramid, starting from improving the living condition of the people, it has been shown that at the lower level of the pyramid, if we can intervene, the benefits are huge, and it is much more what we call cost effective. The more we go towards, like if you are only trying to kind of educate people to have better lifestyle, better health behavior, it does have an impact, but the impact is much less as compared to if we can ensure that the living condition of people improves, if we can ensure that people have access to potable water. And similarly, vaccination of the population is much better intervention than trying to do something when somebody has already developed the risk. So, for example, if somebody has already hepatitis B infection and is already at a higher risk of liver cancer. These are different means by which we can prevent cancer, and then all these different things we will have to consider when we think of cancer prevention.